Acne mechanica. So acne mechanica is basically anything that physically interacts with your skin. So that can be things like chin straps, which work by abrasion, things that can cut your skin, like certain exfoliants that have like plastic beads or like hazelnut shells or something like that in there. Along with shaving, it would also cause cuts in your skin. Another thing is occlusion. So if something is basically restricting your circulation or changing your microenvironment, uh, that's that via basically adhering to your skin strongly. That can be a form of acne mechanica. So biking would be one of those because you're sitting on the bicycle for prolonged periods of time, and it's also done with a sort of abrasive back and forth motion. So that can be a cause of your acne, or a form of acne mechanica, I should say. There's a quick equation that I want to point out to you here. Basically, just shows you what needs to be overcome in order to cause damage. So how does acne mechanica really work? Well, by one mechanism, it spreads the infection. So obviously, if you have a chin strap that's moving back and forth, that's cutting open pimples or whatnot, you're spreading bacteria along with sebum, and that's going to be a form of or a mechanism. So another thing is that it's disrupting the sebaceous gland. So it's either you're occluding it, basically not allowing the sebum to flow out well. It could also be damaging it, specifically that also spreads the infection. Another one is that you're increasing blood flow. So if you again abrade the area, you're going to dilate it, and that's going to increase blood flow, which can be potentially harmful, as the immune system has more access to the skin and can create an inflammatory response. Another aspect is that there's a release of substance P, and at least a pain response. So specifically, if you're worried that something like laying your head down on a pillow is going to give you acne mechanica, that's not the case. Usually something like acne mechanica would come about when you're experiencing pain. So substance P is a very important role of this. So when you're assessing whether or not you're doing something that causes your acne, you should really be concerned with whether or not doing that particular thing is causing you pain, particularly on your face. And if it is, you should try removing it, and you may see reductions in your acne. And again, another aspect is you're blocking the epidermis, and you're changing the microenvironment and humidity, which can have an impact on your cells, or the bacteria on your skin, along with your cells specifically. So you should take all of these aspects into consideration and make sure that you realize that you have potentially a unique situation where you have maybe a strong presence of acne in conjunction with something like a chin strap, or something like acne on your butt or something, and you're biking. So because you have those issues, you are more prone to have an increase in exacerbation of these issues. So trying to take and tailor this specifically to you is going to be a task that you and your dermatologist can talk about, and what can be done. And hopefully this will help you cure your acne. So razor burns or ingrown hairs are not acne, but they, because of their certain similarities in appearance and also co-appearance, I wanted to shed some light on them. So to prevent them, you should cut hairs with the grain. So as you can see, there's certain directions which hair typically grows, and this is one example of them that some professional hairstylists use. So learning these directions of basically, as you can see, the hair is flowing this direction, so you would cut in that direction. And by using this, you limit the potential for the hair to become damaged or sort of incorrectly cut and have the potential to dig into your skin. As you can see here, these are razor bumps, and if you look closely, you can see how exactly they're causing issues. Another way of looking at this, you can see this is a normal follicle, and here is a follicle that is growth is inhibited with skin buildup due to a cut closing or skin abrasion. So basically, if you cut the skin and then it heals over that spot, you can have an issue. Here there's a coiling up of the hair, and also another aspect, which is basically the hair grows up and then back into the skin, which would be most commonly causing an ingrown hair. But there's also other when you look at this, one of the issues is that with someone who has curly hair, as it's growing out, it could curl in early and basically have cut through the sebaceous or the polyfollicular follicle and end up causing issues within a certain area. So if it comes up, curls around, and goes through, which can be an issue, that's going to be causing a razor bump. Now again, the ways to avoid it is cutting with the grain, using moisturizers, trying not to shave really close can also help, along with potentially just not shaving for a while. If you have very long hair, it doesn't really have the opportunity to do this, although because of the way hair naturally dies off and regrows, you could still get some of these. Make sure you shave with a clean blade, because there is some aspect in with that's ingrown hairs or razor burn is not necessarily all physical. There's also a bacterial aspect that can cause issues, and an electric razor may be better because the head isn't really as abrasive, and it doesn't cut quite as close, so there's not you're not creating an extensive amount of damage, which can happen with a razor blade. So although a moisturizer in that case may not necessarily be a great applicable in that case. So that should cover that. Now also using shaving gels and other aspects, that's a whole another issue that you're throwing on your skin, that you have to make sure that that isn't actually causing your in this case acne, and possibly others like this, razor bumps. So you want to look and make sure that you're not basically damaging the skin and then putting something that's stinging the crap out of the skin and causing irritation on the skin afterwards. So why we pick? This is a question that I don't feel many dermatologists even ask. They simply just tell you not to pick, which is absurd. If you have a initiative, if you have something that is causing you to pick, that's what you need to treat. You don't just need to tell someone to stop picking. It's not always that easy. So let's look at one of the things I should say that cause you to pick. So itching can cause you to pick. So if something itches, certainly you're going to touch that and trying to remove that. So if your skin itches or if a pimple itches, you're going to be brought to its attention, even though you don't even have a mirror in front of you or something, and you're going to try and relieve that itching, which may be dubbed trying to pop the pimple, or at the very least irritate the skin. So trying to find ways to reduce itching is going to be a great means of reducing picking. Another aspect, this is just a more epidemiology, is that if you're a female, that's going to increase your risk. If you're a teen, or if you're in your late 30s. For the female aspect, many people in our society actually focus on physical looks of women far more extensively than men. Another aspect is that for teens, there's a lot of pressure, especially around high school, about the way you look. With the late 30s, there's just basically a status quo where a lot of people think that by your 30s you shouldn't have acne. Acne is a teen kind of thing, and for that reason, doing everyday experiences put a lot of stress on you that causes you to pick. So if you're going out and you're going to do something, you're probably going to try to pop your pimple because you don't want anyone to see your acne. Or you want to try and find a way to hide it. More so even than certain people within their 20s. They kind of think, well, it's going away. I'm just I'm just a struggling getting out of my teen years. It's less accepted in your 30s, I would argue. Now, the other aspect is you have OCD, which is, if you're trying to constantly make things neat and tidy when you're looking at your face, it's highly irritating that you have something on your face, and you try and remove that. You hyper focus on that. It's the only thing you can think about. It's out of place, and and because of that, you pick. Another aspect is that it looks ready to pop. So if you go in the mirror, you wake up in the morning, you've been looking at this pimple for a couple days, and you're like, that's a whitehead, that can go, that's ready. Well, you may be obligated in your own right to pop it, and so trying to find ways to understand that acne is going to go away on its own, it doesn't really need to be popped, and finding ways to hasten it naturally without too much physical interaction, or even better, probably for a more practical aspect, is having a really good assessment of a pimple and understanding before you even begin to touch it if it is actually ready to pop, having a standard for pimple popping, if you will. So another aspect of this is that you may get stressed out about appearance. So again, in the late, like I was saying, for those who are in their 30s, if you have something like a date coming up, you may be more apt to pop a pimple because you feel like that your skin will look better. So again, when we try to assess or find ways to reduce picking, we have to, overcome these sort of barriers. Another aspect is general stress. So if you're stressed out, if you're agitated, itching can get promoted in the skin. Along with that, it's just it's an impulsive habit to touch your skin. Just like, something like hair pulling when you're exceptionally stressed, or when you're taking an exam, you may be intrinsically wired to begin to touch your face and trying to remove any abnormalities as you coast over it with your fingers. So again, trying to find ways to, when you're stressed, to find ways to actually reduce this habit is critical. Maybe something like gum chewing will give you your stress outlet for when you're doing something like an exam. There's other ways in music and other things to reduce stress at a particular acute moment that may help you. The last thing is something like stimulants. So if you are stimulated by something like caffeine or Adderall, or even, hopefully to God not, meth, you could actually create an OCD mindset. And so you hyper focus on things, just like you're trying to get work done, so you're taking Adderall. You are basically begin to hyper focus on your skin and become very vigilant, and therefore you can get into a sort of a zone and begin to pick your skin. Along with that, you also have the aspect of adrenal stimulation and the testosterone that results from that. So people with one of the best examples I can give that can showcase some objective understanding of this, or this is more subjective than objective, but it's just something that is noted in the literature, is that there's people who do take meth have something called meth face. One thing that goes along with it is tooth loss, but that's not what I want to point to. What I want to point to is the fact that many people who take meth frequently have poor skin. We could attribute it to its diet, we could attribute it to hygiene aspects, but nonetheless you see them picking frequently. So we want to consider that as well when we're considering how to reduce skin picking and acne. Severe skin picking. There's actually a different term for it, but I am terrible at pronouncing it, so I'm going to just simply tell you that there's are people that have basically a top tier issue with their skin and how they pick, and most of those people, 94%, are female, and 87% of them are white, and 28% are of upper income, and many of them are actually well educated, about 36% of them. So using this as our best assessment of who is the severe skin pickers, we can hopefully understand what roles these play in trying to figure out why we pick our skin. Another sort of, it's more of a qualification, but for diagnosing the condition, but they spend about 1 to 3 hours in the bathroom picking their skin. So their day, they spend probably more time looking at their face than they do watching TV. So if you think of basically how you would, watch TV, they're watching their face. So as you can tell, this is a very severe issue. And what would be interesting, though, there's no study that shows this, is whether or not this sort of behavior is directly linked to acne. Directly linked to acne. That would be interesting to see, because it still isn't anything that directly shows that. But there's also an element of scarring that I'd be interested in. A lot of people say that picking your skin causes scarring, but there isn't a whole lot of evidence to directly show that. So looking at people who have this condition, we can make a better assessment of this condition and acne, I should say. We can make a better assessment of what really causes scarring, which is something I'll get into in the later lectures, or sorry, in the later slides. Comedone extractions. How and when to pop a pimple. This was a bit what I was talking about before, but it's taken to a different perspective, and this is basically allowing you to actually pop your pimple. There's a limited amount of research to show that extractions actually better your acne. Now, initially, there's improvement, but inevitably there seems to be a return of your acne. But again, that's a more anecdotal statement, because there isn't actually a whole lot of evidence to show the improvement. There's only certain studies which show our direct before and after extractions and what people would suggest as a improvement. So what I would recommend is that post-shower is when you do it. So when your face is steamed and a warm cloth, or a steaming kind of cloth, not extraordinarily hot, but just ones that can actually warm your face, can help hydrolyze the keratin and soften it, making it more pliable and more capable of releasing something like the sebaceous blockage. You want to avoid touch activation. You want to avoid any sort of pain. If you feel pain when you're trying to pop a pimple, that pimple isn't ready. That's the best means I can tell you for assessing whether or not you should pop the pimple that's currently on your face. Now, how you should do it. So there's a couple different mechanisms. One you can basically do as this shows, which is you push at the far exteriors of the pimple and you push deep and then push together your fingers. You don't want to basically squeeze too close in, because if you squeeze too close in, you basically push the infection and the clog down and cause even more issues. There's another that basically uses this comedone extractor that is basically a more perfected mechanism of this. So instead of using your fingers, you use this steel object. There is yet another one that has been touted by people like Dr. Oz, which is you take a needle and you put it through your pimple and then you pop it, basically. That just seems very, well, invasive and surgical and scary and not right. Not something you should be doing at home. So I wouldn't recommend doing something like that. There's only one study that shows that, and it doesn't. There's no study that compares the two. So looking at that, we can make a better assessment of what we should do when we have a pimple, and hopefully this gives you sort of the ammunition that you need to assess your skin and approach new pimples. Chloral acne. Chloral acne is basically what almost every YouTuber and all of the nutritionists, nutritional therapists, or your more holistic people talk about. They always talk about, it's the toxins that are in your food, and it's this Western society of chemicals and stuff that is causing your acne. Well, science has looked at this in one perspective that is rather broad, and it uses the name to study these toxins as dioxins. So there's over 211 different kinds of dioxins that are studied, and many are referring to TCDD. This is a primary component this is a primary dioxin that many people have attributed a lot of the effects of our chemicals on the human body to be coming from. So chloral acne is only seen in 1 to 2% of the population. So it's a very, very small percentage of people that actually have acne due to chemical exposure. That said, there are certain elements that will predispose you to this. One is if you work on a farm, because there's constantly chemicals being sprayed, which have dioxins in them, or are them. And another is if in chemical manufacturing. Now, to get it through diet is a dose that is equivalent to the people who present with chloral acne is something I see as difficult. However, there are things like chicken, which is high in dioxin levels, but we'll talk about that in the next slide. Now, how you get rid of dioxins? Well, you get rid of them through your feces, your urine, and yes, your sweat. A lot of people talk about, you're excreting sweat or you're excreting toxins through your pores. Well, there is evidence to show that there is some amount of dioxins excreted in your sweat. How much that is impacting your skin is hard to say, and whether or not that's actually going to be causing your skin issue is hard to say as well. All I can say is only 1 to 2% of people have acne that is diagnosed as chloral acne, but maybe that's an under evaluation. Maybe if we looked at lower levels of dioxins and total presentation of acne, we may see lower levels of presentation. However, we don't have the studies to show that yet. There's certain people that tout oil pulling to remove dioxins, or remove chemicals anyways, and I would question that. I don't think it's entirely wrong, but there's other means of removing dioxins that I'll talk about in a moment. There's also sort of an element of autotoxicity, and inflammation and inflammatory compounds and things that basically, when you get chemicals that are acting on your skin, that may react differently per person to person. This basically goes to show that if you are allergic to any of the chemicals that you're being exposed to, you may not necessarily have chloral acne, but a chemical is causing your issue. So doing something like going organic may be the right way to fix your acne. So it's not necessarily applicable to everybody, but it can be applicable to some. And there are also elements of certain chemicals causing autotoxicity. So you basically, or autoimmunity. So you weren't, you didn't have an autoimmune condition before. Then you got a chemical into your body, and now all of a sudden you have an autoimmune disease, or you may have something like acne, or you may have new allergies. So you could say that the chemical is causing those allergies or something like that, which would sort of make this more validated and more broad spectrum. But at the very least, if you're trying to look at a direct correlation, this is the best I can give you. So there are certain factors to consider when you're assessing acne, and although, as you can see from my last slide, that there is apparently fairly little evidence to support chemicals' role in acne on a large scale. It's not to say that they don't contribute, it's just that the level of direct contribution is probably very minimal. That said, maybe you have an allergy, or there's some other component that's going on that is yet to be uncovered, and for that reason, PCBs, or dioxins, the most general term for the majority of chemicals, will be assessed again in a different way here. So the first way we're going to assess is, for most North Americans, this is the average of where your exposure is coming from. Beef, dairy, chicken, pork, fish, mainly animal products, is where everything's coming from. That doesn't mean, this graph doesn't indicate that beef is highest. It just means that beef is the most general source, because the American diet has a high quantity of beef consumption. If you actually want to look to see what food is worse from this perspective, freshwater fish and butter are by far top of the list here. So the thing is that you're gonna want to consider all different components of food before you shout out that that's the worst food for you. Now, that said, butter is a dairy product, and it has a high quantity of PCBs and dioxins, so we're going to want to probably stay away from that. Milk is low in the quantity compared to other animal products, and but that doesn't mean that it's good for you. As you can see, ice cream is high, and that's, again, from a perspective of the insulin. So taking everything into consideration, you should probably stick more towards a vegan diet. Eat chicken, try and stay away from the skin of chicken, because where most of these toxins actually lie is in the fatty portions of food, because they are most of them are fat soluble. So that's a general methodology of trying to adapt your diet into a more toxin-free one. Now, if you have chloral acne, there's ways that have come about in order to actually get rid of it that are far different from your typical methods. The first thing that you need to do is try and get your levels of dioxins down. So how would you do that? Well, there's actually a chemical substitute for fat called Olestra. That's its brand name anyways. And this fat substitute actually has the ability to basically pull toxins out of your body, and you poop like crazy, and it is basically super saturated with the toxins. Because you're not absorbing any of the fat, you're actually able to hyper-excrete it, because that's what Olestra is. It's a fat substitute that basically is undigestible to the body. And therefore it acts as a perfect medium for the transport of toxins throughout the body, or through the body, I should say, not throughout the body. Now, there is a element where many people take this toxin theory to extremes. One of them reportedly is ACNE no more. So the restrictions that are placed on this diet is extremely extensive, and they require absolute adherence, I should say, sorry. And it could possibly even cause certain nutritional deficiencies and eating disorders. The thing is it's also it uses guerrilla marketing as well, this product, ACNE no more, trying to use quote-unquote testimonials that are clearly paid for, and other means such as spamming YouTube with a slew of different videos that are very poor quality and just showing pictures of acne basically and saying ACNE no more is the future, while basically yielding none of the information about the product. So I mean, if you're really going to consider the toxin and the liver theory of acne, one thing you should look at is conditions like hepatitis, which are basically going to be deteriorating the liver. And the thing is that hepatitis isn't associated with acne. The other thing is that looking at hepatic function, liver function, you could use certain biomarkers to see whether or not those are going to be within normal range, which is done in people who are taking Accutane in certain studies. So looking at those biomarkers, whether they may be off or incorrect or not to look at for a breakout, is to be said, but for the general purposes of a liver functionality, they're in the clear. So these people who have acne have normal functioning livers, and nothing seems to be wrong with them according to these biomarkers. So I have a hard time believing that dioxins, or I should say, I have a hard time believing that a detox theory to acne is actually going to be your holy grail. You need to look at it from this much more holistic and specific approach, as I'm hopefully showing you how to take. So there are many different ways of categorizing chemicals, like I've just done with PCBs and dioxins. Now again, those are very vast quantity a vast quantity of chemicals that are categorized into these big groups. So the more abstract you categorize something, the more difficulty we have understanding it and its effects. I mean, if you're going to classify something as an endocrine disruptor, it immediately puts a negative context onto a lot of different chemicals, and it seems exciting. And because of that, it tries to basically validate something. Anytime something is put in to this umbrella category as like something like an endocrine disruptor. You immediately think it's something bad, and then it disrupts things extensively. When in reality, an endocrine disruptor just simply means it affects our hormone system, and basically everything affects our hormone system, as we talked about. Stress is an endocrine disruptor. Eating a whole lot of food is going to affect certain hormone levels. So, and things like insulin. So just try and be very careful whenever you're trying to look over what's affecting your acne and if a chemical is actually working and what you need to eliminate. The other perspective is, are these working on our body in a extensive enough light to validate their a change? I mean, again, to get the best bang for your buck, you're really going to want to focus on what I talked about earlier. In certain people, and again, in certain people with, may say, an allergy, you're going to want to look at trying to eliminate certain chemicals. So, and this could only be for 1 to 2%, but because there's so many different chemicals involved in our agricultural system, maybe there's 20 different chemicals in a strawberry, and each one of those only affects 1 to 2% of the population, but a strawberry that's conventionally grown could affect 20% of the population, because it affects 2% and it has, let's say 10 chemicals in it. So it has the potential to affect in total 20% of our population. So I mean, what I'm trying to get to is this idea, although we need to be careful of chemicals and there's definitely a lot of potential, we need to focus on trying to eat healthy and in these other perspectives that are much more validated in their effects on acne, than trying to buy the $7 strawberry that's organic. I mean, it's really best to eat conventionally grown 7 days a week than organic strawberries or something, once a week, and eating crap the rest of the week. I mean, it's much better if you try and save your dollar. I mean, I would really only purchase an organic product if it was only 20% more expensive. So if you're going to say buy a $1 thing of strawberries that's conventionally grown, I would only spend $1.20 on a organically grown food, because that's all I can validate. I mean, you could look at things like the Dirty Dozen, but again, you're going to want to consider the fact that you only have so much money and you're trying to cure your acne the fastest and the most effective way for everybody and also you personally. So try and look at this as a personalized perspective, and also look at it as a statistical and evidence-based perspective, and hopefully that'll help guide you through the best means of reducing your acne and also the best way economically you can do it. So this is basically the same thing. I mean, there are hormones, there are antibiotics, there are growth promoters in our food, in our pork, in our beef, in our chicken or poultry. But the reality is that trying to assess all of these things' effect on acne is difficult, and there are FDA maximum values for these products in our food. So to try and state that these are the things that you need to be concerned about with acne is, I think, an over-embellishment. That said, there are people who used to completely discount diet and acne, and hopefully I've shown you that there is significant correlation and can be significant benefit from adapting your diet. So I'm going to say this, and that's focusing on these things for someone who is trying to clear their acne is not the best idea, because you're not going to get the best bang for your buck again. but adding in these into research principles, and also maybe adjunctively when you've solidified the habits and better practices that I've been advocating before this, you're gonna have potentially an even grander outlook on acne and a better understanding of it. But as of right now, it's not something that the majority of people should be focused on, and it's also not something that you should allow to be marketed to you. I mean, be very conscious of anything that's trying to make substantial claims off the removal of any of these components. Again, that said, allergies can play very interesting and dominating roles. So, taking that caveat into account, let's move on. Dermadex mites. So Dermadex mites are most commonly associated with rosacea, but recently, due to a meta-analysis conducted in 2012, they've been implicated in acne. So there are two species, Dermadex folliculorum and Dermadex brevis. I would probably concentrate on Dermadex brevis because it resides in the sebaceous gland. So this is their scientific classification, and this is their life cycle, I should say. So there's a lot of similarities between these mites, and P. acne. One, as I've told you, that they basically both reside in the sebaceous gland. The other aspect is that they both eat sebum. Another aspect is that they're basically in everybody. So just like is in P. acne, these mites are basically, it's hard to find someone who doesn't have them. That said, there's still a correlation between the number of them and a condition. So there's some difficulty basically implicating these directly. These may be more exacerbators of the condition than causes, but these still might play a strong role. And there are still even people with high numbers of these mites and no condition. So you really have to wonder what else is going on here. Well, what may be going on is that, just like in the case of P. acne, there may be subspecies that we haven't basically derived yet that may be better or worse for the condition. There also may be immunological differences in individuals. There may be microflora differences in individuals, and there may even be differences within the mites microflora. I mean, there's a lot of potential for variability here. So this kind of gets in the aspect of why mites actually cause the condition or exacerbation of the condition. One, they eat and basically move around the skin, which can be quite irritating. The immune system, again, could recognize them and react to them. Another aspect is that these actually don't excrete anything, and so they basically just end up dying, and as a result, all of their toxins and such release at once, which may cause an exacerbation of the issue, or exacerbation of the issue being that it'd be acne. It's really difficult to say what this really means for acne and the future studies. However, there's at least one conclusion that we can grab here, and that is, if every other treatment doesn't seem to be working, a treatment for Dermadex mites may work. Now, that said, the treatment I have set up for you, this protocol, basically does take these factors into account, and if you also consider that they eat sebum, so if you reduce their food source, there are going to basically not be as many of them. The similarity between acne treatment and Dermadex treatment is there. So the only thing that's not there is basically something that actively kills Dermadex mites explicitly, or is designed to do so. So that may be something that you can seek out and something that you can study more. Alcohol is something that is said to be anecdotally as a agent that can cause acne. Now, the literature has been pretty muzzled, but or at least conflicted on this idea. There is some original studies that are suggesting things like rosacea are connected, and but those have been sort of fought against with other recent research. So what I think is that there is certainly a some degree of correlation between alcohol use and acne. Personally, I have experienced it myself. The interesting thing is, though, is that this is not actually something that is the most top-tier concern. Again, though, you're trying to tease out the effects of alcohol and make them exclusive to it, opposed to the psychological impacts alcohol can have on you, whether that be stress, poor food choices, and a number of other things. So there may be other ways that alcohol impacts that sort of makes the correlation with alcohol not necessarily strongest. In other words, I mean that first off, this alcohol effect is dose dependent, meaning if you drink one beer, that may not be a big deal and you may be fine. But if you have 16 shots, then all of a sudden you're talking about something that is a much different experience. So whether or not someone just drinks alcohol or someone drinks alcohol to a point of intoxication, that's where you want to draw a line. So there's other chemicals such as aldehyde that can have certain effects, and there's the dehydrating nature of alcohol as well. There's the destruction of A and B vitamins that have been shown to be pretty critical in the aspect of maintaining your skin health. There's alterations in the gut biome. There's permeability that's created within the cell wall that can cause translocation and, again, inflammation and irritation. Like I said before, poor food choices, disruption in sleep patterns, and there is a vasodilating nature to alcohol as well. Also a vasoconstricting nature, which is why we're sort of conflicted on this. It kind of has different areas of the body may be influenced differently by alcohol, such as your skin may flush on your face, but the vascular structure on, like, let's say your forearm may actually constrict. So because of this wish-washy nature, it's not necessarily that this is something that you need to strictly avoid. What I would do, however, is I would avoid excessive consumption of it because of all the other factors that build alcohol use, such as disruption in sleep and destruction of B vitamins. But do you need to avoid drinking that 1 cup of wine? No. However, do you need to avoid that 1 bottle of beer? Yes, maybe, again, if you're allergic to hops or something like that, and that's what's causing your skin irritation. So, like I said, to try and exclude any one food is difficult, but I mean, you can use certain signs and build a certain framework for how to go about excluding a food. Again, like if you're drunk and you wake up hungover and you have dry mouth, I mean that's a clear sign that you've drank too much and that you have a potential for getting some irritation. It may also be not necessarily something that you can see consistently, meaning that you may have to after a year of doing this, you may not see any change. Whereas, if you do it intermittently, this may be something that
causes your acne, meaning you're healthy all day or for months at a time, but then all of a sudden you have 1 or 2 nights where you go a little too hard, and all of a sudden you have 3 or 4 pimples that pop up, and you're like, how'd that happen? But your friend who's been drinking like that all the time hasn't had that issue. They may have sort of bypassed that phase in its effect. But that is super kind of head in the sky kind of dialogue to this. Really, again, avoiding and trying to adhere to some of the things I've said before, that's your best bet. And that's what I'm coming to with some of these new, different sort of theories of alcohol development, is that we don't really have the research, or the research is generally conflicted, and we need better research on it. But for the most part, you could use your better judgment in order to assess whether or not something like alcohol is an issue. So, auto brewery syndrome. This is something I just wanted to talk about because it's really interesting, and this is an aspect that is very, very rare. But basically, this person was infected with the yeast bacteria that can actually ferment carbohydrates, and it was fermenting it in his gut and basically making him drunk off the food he ate, and he didn't even have to drink any alcohol. So, maybe this is causing your issue. Who knows? But as it is right now, this is not something, again, you should be really all that concerned about immediately. Other aspects, such as your glycemic index and all that, is something you should be more concerned about. This is, again, some alcohol-related information, basically how alcohol exposure can create stress, and that stress can eventually cause immune suppression or elevation, or basically dysregulation, and then end up with some sort of issue related to acne. It's really, you can follow certain biological pathways and end up with acne in any number of ways, which is hopefully something I'm showing you. But again, creating a directive for yourself to how to follow to what is an issue. If you never drink alcohol, this is not information that you should really be all that concerned with. But if you do it regularly, creating an absence is probably your best bet. Again, some people may be mad, like, oh man, but I love dairy. Like, why is dairy causing my acne? Like, that's bull. Like, of course it's not dairy. Well, you have acne for a particular reason, and it may be a reason that, again, you love a particular food for that. That's what's causing your issue. The reason you're having acne is because the food that you love, or the food that you eat the most frequently, is the thing that's causing you the acne. It's not something that you eat, again, once every 2 years that's causing your acne. It's the thing that you're eating consistently because you've probably have consistently had acne. So, does smoking marijuana cause acne? So this is another thing that it's dose dependent. If it's there at all, again, we don't really have good clinical studies, and there's a lot of stuff that can be said about the way cannabinoids have action on sebaceous sites and such, but really, and there's also like, oh, it produces cell death, meaning that it would kill the sebaceous sites, but others would say no, there's enough regulation. So because of this wish-washy nature, you don't really have any clinical evidence. But one thing we do have is that marijuana affects appetite, just like alcohol affects appetite, but actually affects it in a way that I would say was worse for acne, in the sense that marijuana, generally you go for a higher sugar food. One of that being maybe a pint of Ben & Jerry's, which is probably one of the worst things you could eat if you have acne. So I would say that marijuana could be implicated, but not directly be the cause of acne. And there are certainly particles and stuff floating around, when you're smoking, so that can get stuck to your face. Should you wash that face, how bad are those particles for you? I mean, these are things that we would love to figure out, but again, if you only smoke once every blue moon, then this isn't something that you really need to be all that concerned about. But if you're smoking every day, every other day, like twice a week or something like that, this is something that you should really consider potentially avoiding for the sake of your face. Caffeine, because of its presence and general use, and also the way caffeine is typically taken in with coffee and a couple things of cream or what have you and sugar, caffeine is probably one of the more predominantly implicated issues as far as drugs. Um, so it can stimulate the adrenal gland, which causes rapid fluctuations in serum hormone levels. It can disrupt sleep. It can also create a dependency so basically you're taking more caffeine, you're not having any benefit from this as far as your wakefulness, and you can have withdrawals from this, which can cause excessive stress. There's an increase in blood flow and vasodilation, which could cause more redness potentially, and it's dehydrating. So for me, I would avoid caffeine if you had acne. I mean, if I was going to recommend something, this is something I would recommend you do, is you not have caffeine. Again, if you have perfect sleep, you feel healthy, and you're absolutely cannot get rid of caffeine, try and switch your medium. So instead of drinking out of coffee, you could try and with a tea, or instead of with either one of those, you could just try and a pure caffeine pill. Again, what you're trying to do is eliminate something that you've done consistently in order to try and see the effects of it, in order to try and see if you're going to get better from it with the least amount of disruption to your daily life. So there's another opinion to caffeine. Some say it's a diuretic and therefore detoxifying. Others will say, well, it increases blood flow, so you get more nutrients to the skin and makes it better. It's an antioxidant, it's an anti-inflammatory. So, and the last thing is that there's difference between its internal effects and its external effects. So, also its influence is dependent upon factors of the how much you're taking in and the frequency of which you're taking in. So I'm beating a dead horse like over and over again, but try and take into account as many factors as possible, and try and put yourself and understand where you are actually positioned in relevance to your peers. I mean, if you're someone who's taking in twice as much caffeine as your friends and family, you may be like, well, that's probably an issue. So you could try and taper that back, or if you feel that you're super sensitive to it, you can taper it back. It's all about trying to understand yourself and looking at these mediums of and their influence in order to try and better your skin. So all those were in some way or another fairly loosely connected with acne, and not necessarily completely supported by data. But in my opinion, there's something to be discussed and altered. Now, this is something that is unconditionally an issue with acne, or at least some acne polymorphisms. So steroids are certainly implicated, such as testosterone and hydrocortisone. There's anticonvulsants such as lithium, which can actually cause this is the said way it's causing acne, is it creates neutrophil migration and degranulation um, of in 10 to 40% of people. Um, so, and this is basically means in 10 to 40% of the people you see these acne polymorphisms. So, um, there's also butates and bromides, and those are all things that you kind of want to consider if you're taking that could be causing your acne. Um, I mean, out of all the drugs, they always say that, oh, this could benefit your acne. We also need to acknowledge the fact that certain drugs you're taking could be bad for your acne. And, you know, I'm not going to be someone who's going to say you need to take yourself off anticonvulsants. You should not. You should first speak to your doctor about the condition you're having and see if you can develop a way that you can maybe reduce your dose or try and find a means or an alternative medication. Try and find a means of sidestepping the effects that the drugs could be having on you. So you really want to be sensitive to the idea that drugs could be affecting you. And if you're running around trying to remove dairy and a variety of other things, again, if you're that's a good thing, but if you're trying to get clear skin, you really want to find your personal, like, the worst thing for you. And in many cases, I would suggest that it could be that something like an anticonvulsant is what's causing your acne, and that's why you have it. And maybe you just, once you finally know what the issue is, once you have an acknowledgement, is like, listen, I could get rid of my acne if I get rid of this. Isn't to say, but once you have an acknowledgement that something is affecting you a certain way, it's not a mystery, and I feel like you can better understand your condition and work through that, opposed to being frantic about why me, why is this so bad. Once you finally have an answer, you can be like, oh, okay, and live your life the way it should be, or the best you can, and hopefully that gives you some motivation and understanding of, from this perspective of drugs and acne, how you should take this, and be cautioned that you should take it in a very slow and methodical step process that goes through all of the medical mediums and your personal for your own personal good. This is something I'm going to cover real quick. Basically, some people like to say that masturbation causes acne. Can that actually happen? Cons: there's mineral excretion, so you have zinc that comes out, you have, no pun intended, you have magnesium. There's elevations in prolactin. Others may say that there's a calming effect, and so that it isn't harmful to you because it relaxes you, de-stresses you. Another aspect is that it declines serum testosterone, so when that means it's suggested to be good for your skin. If you're taking a zinc supplement, you should be fine, and just don't go at it for 6 times a day. Other than that, you're not causing an issue with your skin. Okay, there is one possible way, again through an allergenic mechanism. There's some people who actually have an allergic reaction when they have an orgasm, and that can cause a variety of different issues, and because certain proteins are created through enzymatic action that would otherwise not be created during this process. So, could you? Yeah. Likelihood? Really, really low. Like, below 1%, I'm going to say, anecdotally. So, just take it easy, alright? Not something I would immediately be something of a cause for concern.
Prone/sensitive skin. So what makes someone have acne prone or sensitive skin? One, you have enlarged pores. increased nerve development, namely in the sebaceous gland, epidermal thinning. Um, that basically allows the immune system, which is usually separated by the dermis, to have access to the environment. And basically, you have highly immune reactive cells that can interact with everything that we interact with on a daily basis, whether that be maybe something like pollen or some sort of chemical irritant or something like that. The other aspect is that bacteria also have increased access to your skin as well, and these highly immune reactive cells. The other aspect is that there's actually an increased number in these epidermal sensitizing cells, like Langerhans cells. And because there's an increased number and an increased accessibility, you have sensitive skin. Another aspect is that there's changes in within receptors, so there's an increase in cellular receptors such as maybe androgen receptor, toll-like receptor 2, corticotropin releasing hormone receptor. So that would basically mean that when you're stressed out, you basically have an increase in your sensitivity to the stress component of acne, and therefore stress affects you more severely than a person without a prone or sensitive skin. Another aspect could be increased neural activity. So you have basically hyperactivity. You have poor clearance of things like substance P or nerve growth factor. Other aspects, you could have nerve damage. I mean, these are all general perspectives of what's could be recognized as someone with acne prone or sensitive skin, not necessarily indicative of everybody who has it, but this is certainly something to try and put into context as far as what you can look for as far as a profile for this criteria. Why you? Why so bad? Well, there's changes or differences in polymorphisms in tumor necrosis factor alpha, which basically would kill bacteria. There's differences in a liver enzyme called P450, which has been implicated in acne. There's serum adipodectin A1 and hypersensitivity to P. acne, more virulent strains, occupational differences, sport differences, so extracurricular activity differences, nutritional factors, and much, much more, as I touched on. So, I mean, that's why it's so bad. It's up to you to really figure out exactly why. Let's expand on that a bit, though.